So joining me now again is Dr. Scott Miscovich to tell us more about the recent numbers that we just heard of. So, disturbing because Kauai had seen no new cases for a while, the longest out of all the islands and counties. But what happened here?
Well, again, now we have, I think, the word of the day and the word of the week and month is cluster. And so you just need one positive person to go into a household. This virus is so contagious by respiratory spread that there it is. And the entire household we're finding is coming down with it. I'd be real interested if these are symptomatic or asymptomatic because, we have so many people that just don't know they have it. But this is a cluster.
And the other thing too is we heard rumors of another cluster forming in Hinamauka. Can you give us some details about that?
Oh boy, that's just kind of not been reported yet, but I've been given the okay to discuss it, and I'd like to just get ahead of it to talk about what is the proper information. Yesterday, late morning, there was an announcement that one of the staff members was tested positive. So I received a call from a close friend and colleague, Alan Johnson, the CEO. We had a team up there in about an hour and a half. And already yesterday, we tested the entire facility. And we have already received the results back that there were no other positives. So I think it's a good lesson on how to deal with this. So it's definitely not a cluster. It's a single individual. We immediately communicated with the Department of Health, again, working with Sarah Kimball over there. And it's just the way it's supposed to be. I feel very confident so far with what we have that this isn't a cluster or an outbreak. They're taking all the infection disease precautions, and all the staff and all the residents are notified. So we'll be back up there a week from yesterday, 7 days, testing again. As we've stated with like the Halinani, you go 2 weeks in a row to make sure that there's no positive cases coming out, and that means you have the disease essentially out of that facility.
Do you think we are doing enough testing? I know we talk about this often with you about kind of this hesitance by the state to be aggressively doing broad scale testing. Has that changed at all?
Um, I'm doing aggressive testing. The mayors agree with aggressive testing. All the mayors have been aggressively testing, and Kauai is a different story because they've had no prevalence. I do believe there's a strong new feeling of cooperation with the Department of Health. I think between what we're doing with them, and we're certainly reaching out a hand of cooperation to them. And I think it is tough to think that the Department of Health could have just mobilized and done all the testing we just did in a couple of days is probably a challenge because they're focusing on contact tracing, which I do agree with, contact tracing. So do I agree we've done enough testing? No. Do we need to do more going forward? Yes. And that's how you deal with clusters. Clusters must be, look at what we just did, Annalisa. We basically had a positive at 11 o'clock. By 3 to 4 o'clock, everyone was tested. Everyone was told about the nature of what was going on. The people that were in the close circle that were, contacted in in the same room as that counselor, they were sent home on quarantine pending testing. And the facility was sterilized. That's how you deal with it. Don't wait. Don't ask people, say, please come in. Say, you need to be tested. And don't wait till a person is symptomatic. That's the biggest thing that frustrates me. We need to test people asymptomatic or symptomatic. If you're in that close counter of, say, 30 to 50 people that came close to that person, test right away, quarantine until we start getting results back.
And that's the concern that we hear from viewers all the time is that, it's been the private sector who's really taken the lead on this testing. And now with the state identifying more of these clusters through contact tracing, do you see kind of the tide changing? Do you feel like they will support more asymptomatic mass testing?
I can't speak for them. I hope so, because it is what's going on across the world. One thing I can tell you is I have had an unusual, I'm feeling like I'm almost living in my own Netflix series. I was contacted about 2.5 weeks ago by a state on the mainland that had found out about what I was doing and was questioning me about, like, can I help advise them on setting up testing protocols? They wanted to do similar things that we're doing. And then I get another contact, and then another contact. And then I was contacted now with an organization working closely with, it's a large national and international US based government service contractor. And over the last, say, 2 weeks now, I've looked at 14 different states' proposals for testing. And what they're asking for is nursing homes, senior citizens, cluster outbreaks. They want you to be responsive in 12 to 24 hours, first responders, police, ambulance, hospital, and they want drive throughs and they want pop up testing. What does that sound like? And I'm like, yeah, we could do it. We could tell you how to do that. We've just been doing that for the last 12 to 14 weeks. And so I'm now working on, I could whip off the names of the states. We're talking to Navajo Nation, Arizona, California, Texas, North Carolina, Michigan, Massachusetts. We just put a proposal in for Southern Ohio. And I guess the reason I'm bringing this up is they know that they can't do that as a state or as a Department of Health or as a county. They're outsourcing it to organizations. And maybe that's something that the state of Hawaii or the counties will want to do, because that is not how the current day Department of Health or county health departments are built at this point. And this is massive. This is massive. So, for example, we just finished doing Southern Ohio, which is very similar to Oahu, just about 900,000 people, Cincinnati. And of the 900,000 people between now and the end of the year, they want you to expect that you're going to have 300,000 to 400,000 of 900,000 that will be tested. That's half the population, you know. So that's just an example of what the rest of the country is doing. Granted, their prevalence may not be as high as ours, but look at our trend. The way you keep your prevalence down is test, test, and test. So perhaps
Mhm.
our state will think about that, because I think all of these states are using CARES money to do it. And, so
I'm glad
it's
you
out.
brought that up because, we followed you all throughout from the very beginning of this pandemic, Scott. I remember at the CVS drive-through pop-up, just really pioneering it for Hawaii. But, people still ask, it's like, why is it just you? Why aren't we seeing more groups, more agencies step up to do what you're doing and get CARES funding? Because, we've talked about this. You haven't had any state support. You rely on volunteers. How are you making money from this? Let's be frank about that. You are still donating a lot of your time and volunteer work and all this. How can you go forward? Is there CARES money for this?
Um, that's a really good point. We have developed a way that we can rightfully bill some of the insurances for it. And so shout out to HMSA, who has supported this program. So they get a big round of applause from me and are standing up, as they always do, for the community. Yeah, I'm still losing on this, but the fact is that the insurers are starting to cover some of it. And yes, this probably, I can't keep supporting this, because I mean, this week alone, I'm probably going to be doing 3,000 to 4,000 tests with some of the programs we have coming up. And likely this should be put into a larger, funding, and maybe large organizations should be involved with it. Now, I have tried and have successfully tried to teach a lot of the other organizations to do it. So we have Ali'i Health in Kona that's doing it, and some of the urgent cares here are doing it, and some in Kona. So we have tried to share the technique with everyone. But back to that Kaneohe one, I've been told by now, all these people looking over our shoulder, we were the first in the country doing this, and they found that out. And we were the first ones to model the South Korea model and successfully do it. And that's kind of why I guess people are finding me out here in Oahu. That just kind of makes me smile.
Well, and we do appreciate it because, again, without maybe your pop-ups and your initiative there, we wouldn't be able to identify a lot of these people that are out there that may have had it asymptomatically and everything like that. But at the same time, how can we make this model sustainable where the state is picking up some of this tab And, I spoke to Arcadia Family of Companies CEO, and she was saying that they also had to front the costs for their mass testing because they are a
Yes.
responsible company. They wanted to do this for all of their employees, which isn't cheap. So again, how can we do this on a broader scale for the state going forward, especially since this is part of recovery?
I that's a really good point. Let me tell you something that I said on your show that is first, what we have to do is we have to prioritize. And the first priority, which is what all these other states are doing, every one of these requests for proposals that are coming from every state is prioritizing nursing homes, senior living, and the dangerous areas, these communal housing, communal living, because as we just saw, look in Kauai. That's a small group. Look at the pastor out there and his
In
congregation
Waipahu, yeah.
in Waipahu, right? Those are going to happen, and so the answer is, I my biggest concern right now is Arcadia, which we did, and Susie was terrific, and now we're working down there with Tina and her group at Avalon Health. These are great organizations, a lot of wherewithal, biggest ones in the state. What about the other smaller ones, like the one we just had, the two homes on one side in Waipahu? We need to help them. We should be testing these. All of our care homes should be going through monthly testing standard, symptomatic, asymptomatic, preventative testing. Don't react to it. They need help. The state should be saying, fund it, do it, test it. And our other, look at just like Kinamalka, addiction treatment facility. You know how many group living facilities we have in the state right now? You know how many clean and sober homes are out there, or the homeless shelters and things? Those should all be tested minimally monthly. And the state and the CARES Act should be funding that, because those are the disasters waiting to happen. And then we do need to have a large scale cluster. I'm reaching out to the mayor again right now, and while we're on this, I got a call back from his team to talk about setting a big drive-through up out in Waipio again next weekend, because you can see there's a circle that's drawing around where the clusters are out in that area. But that's what we have to do. We now need to make testing available to that population, because there's probably going to be a lot more interested people to say, uh-oh, is it me or not? And should I get tested? The answer is yes, get tested.
Yeah, and the numbers will go up because the more you test, that's just kind of part of the numbers game, right? So, is that something to brace for if you
Oh
continue
yeah,
to do
I mean,
this?
yes, we need to brace for it. The numbers will go up, but the whole idea is containment. The whole idea is that if you pair the type of aggressive testing that we're doing and that we're advocating in the rest of the country is, with now the increased capacity for contact tracing by the state, I think that's the partnership that makes us contain this and doesn't have one or two or three spread out to 30 to 50. That's what we have to stop. And then again, keep it out of these very vulnerable areas and groups. And let me bring up something. I just had a long discussion down there. As we did earlier on your show, I was down at Halinani doing more testing. I had some talks with their leadership, and they brought something up that I haven't talked about, that I haven't heard anybody in the media talk about. The people of Hawaii need to understand that don't be ashamed if you think you have this disease. There's a lot of kind of worry about workers. There's a lot of kind of cultural things that if people feel like, oh my God, I have it, that I'm going to spread it, I better not say anything. I'm going to sit home and be sitting here with my cough thinking, oh, Mel, maybe I do have COVID, but if I come forward, my coworkers will be mad at me, or my family's going to be embarrassed or ashamed of me, which, is something that our diverse ethnic backgrounds will have. And they shouldn't be. Please, people, you need to step forward. There's no embarrassment with stepping forward and saying, I think I need to be tested. I might have the disease. What you need to worry about is the other way. If you sit quietly and spread it to 20 friends, that's more concern. But if you step forward and get tested and get quarantined to be done for 14 days, you're doing more for the public and your work and coworkers and family than you would be if you sit there in silence. And your employer will benefit. Everybody benefits by not spreading it. So very
Yeah, that's a
important.
good point. Yeah, because
Yes.
that's why I think in the news it translates that we kind of have a hard time finding patients who have recovered who want to talk about it, even at that level. Like they've had it, they're fine now, but very few of them want to share their stories, I've found.
Well, the other thing we talked about, and this is, within the facility, and people who really I really respect their opinion, it was that they're also worried that it would stop them now that their jobs are opening up to be able to go back to work, and they would be stigmatized to not be able to go back and earn a living. Because let's face it, everybody is just so challenged by the loss of income and not being able to work, and then they're also worried that there'll be a bad rap will be put on their workplace. And we have to, maybe as a public and as the media, stand up and say, people of Hawaii, workplaces, coworkers, your coworker didn't do this. This is just part of this pandemic. Please, reach out and offer support. I think we really need to consider that to stop this from being, something where people want to hide in a closet over it. That's
Yeah.
not what we should do. Yeah.
Kind of reminds me of what happened with the HIV/AIDS epidemic. It's
Sure.
like when
Yeah.
when you hear about it, people were really just deathly afraid of even going near anyone at that point. So
Yeah.
it'll be interesting to see how
Well,
this plays out.
another thing, here's a perfect example. In this same group I was just with down there. So granted, we have a really nice containment of everything down there in Halinani to this one wing of the one ward, and staff and everything, even as of this morning, has gone very, very well. Uh, we tested everyone. So there are workers coming up who are totally a different floor, a different ward. They could be in the kitchen or something. Their
Hmm.
kids are not allowed to have the friends of their other kids because they said, "Oh, your mom works up at Halinani. Don't go to their house."
Uh,
No, that's, again, I we need to get the word out. No, that's not the case. Just because they are absolutely in that same building in a complete different ward and don't stigmatize their children or the rest of the family or anything like that. We need to get that word out that's not the case. So,
okay. Yeah, that's a good message. I didn't even think about that as well. But yeah, we'll continue to spread that word in our shows and on our social media. So thanks. Always good to talk to you. Always enlightening when I talk to you, Dr. Miscovich.
uh, well, I think the word shouldn't be enlightening, but lightning, because this is happening at lightning speed. I mean, I just cannot believe all the things that change every single day.
Mhm.
And but you know what, Annalisa, thank you. Thanks the rest of the media and your station for doing what they're doing. Because you know what? It's communication. We have to talk to each other. We have to communicate. We need to not have false narratives out there, just like what Holly Nani's doing. Boom, it's right out there. Hina Malka,
Mhm.
right out there. Let's not let the rumor mill go. Let's talk about it. Let's get the facts out. Let's stop it and move on to the next one and stop it.
Yeah, very good. Well, happy Father's Day to you.
Thank you. Thank you. Looking forward
We'll be
to it.
seeing, I'm sure, celebrations again, but safe ones,
Safe
hopefully,
one. Safe
for
ones.
this
Yes. Hopefully
weekend.
everyone's safe. Celebrate dad. But I said it last night on the show. Use the trade winds, use some fans, get the air moving, be outside. Don't be sitting in a stodgy room and it looks like it's going to be nice outside. And that's how you're safe on Father's Day.
Happy Father's
Thank
Day,
you.
everybody.
Happy Father's Day. Thanks to everybody. Thank you.